Hello, everyone. My name is Sarah Elsa Abraham, and I am a speech language pathologist working at PlayStreet. PlayStreet is an organization that provides educational services to help the child with special needs become independent and live up to their potential. We offer parent empowerment programs, an integrated schooling program, and a variety of clinical services. As April is Autism Awareness and Acceptance Month, we wanted to bring to you the pioneers in the field of autism to guide us all and spread the awareness and knowledge. Today is our 16th talk in the series, and we have the amazing Renee Roy Hill with us. Renee Roy Hill is a speech language pathologist and has provided therapeutic assessment and program planning for adults and children with oral placement, feeding, and motor speech deficits for over 17 years. She is also the owner of Crossroads Therapy Clinic in New Braunfels, Texas, and is a member of the TalkTools Speakers Bureau. She is an oral placement, speech, and feeding specialist, certified orofacial myologist. She's a TalkTools instructor. She's also on the board of directors of the Oral Motor Institute. And she is also the creator of the TalkTools Schedule Board Kit, the author of TalkTools Apraxia Program, and the co-author of iSticks. Renee, thank you so much for taking time off your busy schedule and joining us. It truly is a pleasure to have you with us. Share your experience and knowledge. Do you want to share a few words to our viewers before we begin?
Absolutely. Well, thank you for having me. I think what you are doing is amazing and fabulous and a big undertaking. So I commend all of you for putting this together. I can't wait to see some of the other talks.
Awesome. So Renee, just to give you also an idea of what we are doing is our main focus of this entire summit for this year is to make our few viewers, which again is a group of just not only special need parents, but we also have professionals also coming in, make them more aware of what is the importance of relationships, movement, and consciousness, especially in children with autism. So our topic for today is the connection between feeding and speech, and that is your field of expertise. So we just want to get all, we just want to know how you worked with it over the years, what have you learned, and how it can be beneficial to both parents and professionals as well. So a lot of them really don't understand that connection, or that even that there is a connect of that sort. So I think that's what we want to bring it down to the basics and get people to understand that there's so much more going on in that. So if you're ready, let's jump right into our questions.
Let's do it.
All right. So the first thing that I want to ask is, how important is this connect between feeding and speech? And why do we as professionals as well as parents need to know that there is a connect and what we need to do about it?
So I guess if we kind of think about historically what speech and language pathologists are taught, we're taught as far as our training in university that speech is something that is develops around language. And it does, and that's really important. But one of the things that we're not taught too much, I think, is that there's a connection between speech and the motor system. And that's what I really started to learn several years out of college when I started to do my own continuing education, is that some of these kids who aren't talking or are not talking clearly or well, it's not always about language. There can be other things going on. And one of my first trainings was looking at the connection between feeding movement, or the muscles you need for feeding, and the muscles you need for speech. My first continuing education class that ever meant a lot to me was through TalkTools and Sarah Rosenfeld Johnson, who founded TalkTools. And that was my biggest takeaway after 6 days of feeding and motor speech training is really thinking about how the motor system, you have one motor system, you have one mouth, you have one jaw, you have one set of lips, you have one tongue, you have two cheeks, and all of those muscles are used in speech. And so when we evaluate kids on the spectrum and other kids in general, one of the things that we look at more formally than some might is that motor system, and how if the muscles aren't moving for feeding, so example, the child might be not chewing well or not chewing anything. Maybe they're still, 6 years old and they can only drink from a bottle because they haven't been able to transfer. Some of the reasons that happens might be different, but those things that they're not progressing through that should happen in normal development affect the motor system. And then we can see that connection to speech. So it's really important to know that there is a connection and how to look at it and rule it out, because not all children with autism have a motor issue, but a lot of them do.
All right. Yeah. So when it comes, like you were saying, that children have a normal development, I think a lot of parents do come to us saying that, their kids are picky eaters. So do we, put all of these children under the same thing of, saying that they have a feeding issue, or are they two totally different things?
That's a loaded question. And that's where having professionals that can look at those kinds of things from different aspects is really important, because picky eating, there's always an underlying reason for it. Nothing happens for no reason. So when we see picky eater, then we have to figure out why. Why are they a picky eater? Is it behavioral? Is it sensory? Or are they picky, if we're thinking about this motor connection, are they picky because some foods are just really hard for them to eat? They can't chew very well. They can't swallow very well. They can't move food around in their mouth very well. And so that's going to lead them to make choices that maybe are easier, feel better, and work for them. So, how we treat a picky eater can differ based on what we see in our evaluation.
All right. That brings us right into our next question. Like you mentioned, kids who have issues in terms of behavior, they have feeding issues in terms of that. They have children who just have anxiety around different types of food. And, you've got children who've got sensory difficulties. So how do we know, even as professionals or as parents, how can we differentiate those? Because they all look the same. I mean, they just might not be. Yeah. Right.
Exactly. We can see that they don't eat, and we can't see the underlying reasons a lot of times. And that's, I wish I could say, go take this one class and you will learn everything you need to know to help a picky eater. And it just isn't there. But the more you know about all of the underlying implications for picky eating, that's where you start having to really dig, and then to take different courses and go to different things to kind of figure those out. So, understanding the metabolic system and the gut, the whole physical system is really important. Understanding swallowing, because we can't rule out swallowing as a problem, and swallowing issues, understanding the connection between their overall sensory system and their anxiety. Kids who have anxiety in other areas are probably going to show those anxieties with feeding if there are some of those underlying issues that are causing some of those problems. So again, behavior is one of those things that we see as a result of underlying issues. So, in my evaluations, if I kind of try to narrow it down a little bit, I always want to think about, what are the things on the inside of their body that might be causing some problems, and have we explored all of those? What is their sensory system like outside of feeding? They don't like a toothbrush in their mouth, or even something touching them. Food is going to be really challenging. So there might be that connection. Looking at their motor system, what are their muscles doing with their jaw, their lips, their cheeks, and their tongue? And that's where TalkTools is really good at teaching us how to evaluate muscle skill outside of feeding, so we can kind of take the anxiety away and just look at the motor system. And then compare that to the foods that they might be eating. And then where are they behaviorally, if we can call it that? Do they trust us? Do they understand when we try and manipulate things that that's part of the learning process, or are we still having to work on that? So all of those things, are red flags that we need to look at and maybe treat individually before we even get to food. So sometimes in my therapy, I might not be touching their food preferences for 6 months, because there's so many other things going on.
That's really nice. It's a very important topic. I think, when we say that now, even as parents, like, because a lot of our viewers are parents now, what are those red flags? Like you were mentioning, like, okay, there are a lot of issues that come in, but as parents, what are these things that they can, look at and know that, okay, this is not just a phase or a child, they're just being picky about eating, but what are those red flags that parents can actually notice and tell, okay, it's time to bring in my child in for assessments or something's going on wrong there?
Right. I think parents need to feel okay with following their gut. If you kind of know that little saying, when you have that internal issue that's saying something doesn't feel right, that's the time to go in. You may not know the answer, but when you don't think something is going on that is normal, then you need to seek help. And I think a lot of parents are steered in another direction by their pediatricians and their doctors. Oh, it's just a phase, it's going to be fine, go through it. But when you feel like there's a concern, that's always a big red flag to me. The second is when your child isn't eating a variety of foods, when you feel like you have to fix them one or two things all the time, or even 3, 4, or 5 things all the time, that's a red flag that there's something going on. So, we've got to think about our food groups. Do we have dairy? Do we have meat? If we eat meat, do we have vegetables? Do we have carbs? Are they sticking to one type of food? That's a red flag that something's going on. Do you feel like they don't eat enough at a meal and maybe they're eating just a little bit here and a little bit there? That's a red flag. We should be eating meals with snacks between and not grazing throughout the day. That's a red flag. And sometimes we facilitate that because we follow their lead, and then all of a sudden we can't take them back to kind of what's normal. So, that would be a red flag. If you see any choking or gagging on foods, that's always a red flag. If you feel like they're not eating age appropriate foods, maybe they're eating a lot, but they're not eating things that you would expect them to eat as a 5-year-old or a 6-year-old. If they seem to have issues with food being near them, that's not food that they prefer. If any kind of strong behaviors or strong reactions to food, that you can't talk them through, that would be considered a red flag as well. And then, if they're not growing at the rate that we would expect them, if somebody has said nutritionally, we don't think they're getting adequate nutrition, that's always a red flag. So, feeding issues are different for everybody because it's cultural. It's based on family values. I think you should eat vegetables, but some parents don't eat vegetables, and so their child's not going to eat vegetables. So, it's sometimes kind of hard to pick all that apart. And that's why I always do a feeding evaluation, regardless of if a child's coming in for feeding, because I want to make sure that I can't pick up on some of those red flags and those connections that maybe a parent isn't aware of as we're starting to think about the big picture for our client. That's probably a very long-winded answer for that question.
Actually, a lot of information, but really wanted information. I think people need to hear that, and that's really nice. But Renee, you were talking about, in previously also, you mentioned that there are so many factors that come into play. It's not just in terms, we know the motor part of it, but you were saying that there's a lot of factors even before we even reach feeding. So could you elaborate that a little more for our viewers to understand that better?
So, certain things should happen in normal development with babies. And, we see as we start to work with more kids with autism, we don't identify autism in babies. So we miss that part. Sometimes when there's a diagnosis that we know there's going to be problems, we can be on track and kind of stay on top of things early. But autism is one of those that we kind of get later. But in normal development, lots of things should be happening. Motor skills should be developing. The sensory system should be exploring new sensory experiences and going through this whole process. Feeding really has kind of a normal process to it. We bottle feed and breastfeed, and then we should be able to transfer to a cup or a straw, and then we should be able to start spoon foods, and then we should be able to chew, and it all should happen kind of naturally. So, when we see some of those things that are not progressing in the way that we would expect, those are some of those things that we, kind of need to think about, and we know for kids with autism, when some of those things don't go right and then they prolong, then our kiddos get stuck in them, and then it's hard to get them out. So, some of those things, when we see some of those early signs of kids not being flexible with other things, like flexible with change in the environment, flexible with a new plate or a new cup or a new spoon, or going from the bottle to going to another phase of feeding. Those are some of those early things that maybe if we knew about them, we could kind of pick up on. Maybe there could be something going on that we could help with. It could be that it's not going to turn into a big major issue, but my feeling is, if there's any little issues, let's tackle those so that we don't get to the big issues.
All right. Yeah, that's definitely a very important thing. I think parents need to understand the normal development of it, to know that, okay, there is something going on that's not right.
That's right. Yeah. And we're not taught that. Parents aren't taught that.
Very true.
I didn't know.
Yeah. Very true. I think that's something that really needs to be addressed. And I think,
Right.
even here in our culture, that's something that we taught that we need to feed the kid, but how does it go is something that we really need to look into.
Exactly. What happens when it doesn't work? I think another big one that we don't think about, and I thought about this earlier with one of your other questions and forgot to mention it, constipation and bowel movements. That is a big piece that we see in connection with kids who have feeding issues because they don't get all the right foods and calories and those kinds of things. And that can be a big red flag, or something that we might see earlier in development that's telling us maybe there's some gut issues that are associated with feeding that sometimes get overlooked.
Very true. Very true. So coming into now, feeding is something that happens, like we see them as soon as the child, is born, we start feeding them. And would you always say that feeding and speech difficulties, is it always there for every child who has a feeding difficulty? Do we always end up having a speech difficulty, or, what would be your input in terms of that?
Not necessarily, and innately you kind of would think, oh, it must, because if they can't eat, they must not be able to speak. But that's not necessarily true, because a lot of people learn to adapt with systems that don't work in one area and do work in the other. And they always kind of surprise me because I do work with so many where there is some of that connection, but I wouldn't say that we need to expect that, but we need to evaluate and know what we're looking at and what parts might be affecting the others.
Okay. So when, like you were saying, now you work with kids who've got both feeding and speech. Yeah. Most of the time we end up having a lot of kids who have both of that. So what would you, as a professional, would you say, like, do we work on the goals together, or do we work on it separately, or, how does it go?
Yeah. So it goes different based on the client. A lot of times, feeding is the most important initially, because feeding is our nutrition, feeding is our life sustaining skill. And so when there are kids who are having extreme issues with feeding, and, usually there's going to be a motor issue and a picky eating issue and a failure to thrive, I probably will just focus on feeding. But in the back of my head, I always know that I'm working towards speech. So everything I do with feeding, in feeding movement, when we're talking about a child who has a motor feeding issue, an oral phase feeding issue, I'm always preparing for speech. But, if it's a client who just, if feeding is that difficult, we may just want to focus on feeding. As me, as the professional, that doesn't mean there's not another professional that's working on speech and language and some of those underlying skills that they need for language and speech development. But, in the US, many of my clients I see once a week, once every 2 weeks. And so, when you're talking about only getting a very small amount of time with the child, you really have to focus. And then parents need to feel okay doing that too, because sometimes we put all of this pressure on a parent. You got to work on feeding, you got to work on speech, they got to walk, they got to do this, they got to do that. That's overwhelming for a parent. So, I always consider where the parent is at as well. And if you're very overwhelmed with everything that's going on and you've got to pick, well, feeding, if your child is having trouble with nutrition and growth, feeding should come first. But having said that, I do have lots of clients where I'm working on both of them simultaneously because they have the behavioral capability to do that. They have parents who have the availability and time to work on multiple things, and they all go hand in hand. So, it depends. And I hate that word, but it does depend.
Yes, it does. Okay, yeah, makes a lot of sense. So you were talking in terms, you've seen kids, I'm sure, like you've been doing this for a very long time. So could you give us like some examples? Because a lot of the parents that come to us also, they kind of expect it to happen overnight. It's like, okay, I brought her in, or I brought my child in, she's gonna, start eating.
She's gonna fix it.
Yeah, quickly do it. So how long does it usually take? Could you like share some experiences with children that you've worked, or how does it go?
Sure. So again, it depends on lots of factors. First and foremost, the child. When I have a child who comes to see me who has autism, but has interpersonal engagement. They enjoy being around me. They like to learn. They like to do new things. That doesn't bother them so much. Sometimes things can go pretty quick, where we can, in a matter of a few months, have 3 or 4 or 5 new foods. And sometimes once you start to teach kids to be flexible about trying new foods and where does the food go in your mouth, and figure out which types of flavors and consistencies they like the best, and you go in that direction, you can get some nice progress really fast. And then we don't do feeding therapy anymore. We just needed to get them started. The more factors you layer on to the problem, the slower it goes. So if the client has motor problems and they're picky and they have behavioral issues around mealtime and they don't like coming to see me and they don't want me to change anything, and they have constipation issues and my stomach hurts, that takes a little bit longer because we have to peel back every piece and work through all those little issues to get to the point where we have success. So, I think as a parent, as you think about your child, and, if you know anything about some of their feeding problems, maybe you've already seen a therapist and they've already told you, oh, we have this, and this to work with, you can expect that's going to take a little more time. How often do you get to come see me? Can be a big factor. And then the biggest factor is how often do the parents work on the issues at home as well. So unless they're coming somewhere 5 days a week, most of what I do with the clients that I see require the parents to practice it at home, whether it's working on trying to desensitize them to something in their mouth or desensitize them to change. If I'm only seeing them once a week, that's going to take a very long time. So my job as a good speech therapist is to create homework that's doable at home in little bitty steps. And those teeny tiny steps can have huge ramifications later. So, home participation, and is everybody on the same page with those feeding issues is a big part of success. And, I tell most parents when I do an evaluation, I know more about how I think progress is going to happen after 3 months. So 3 months gives me enough time to see how willing is this child to work with me? How fast does this child adapt to change? How much is the parent doing at home? And I can sometimes judge things a little bit better. So I try not to tell parents, give them any real idea until we know more about their child and their home situation and kind of where that difficulty is.
Wow. So Renee, just coming in, like you were talking in terms of children on the spectrum. So that's our focus for this month. It's a lot more different when you work with children on the spectrum than with children who've got other needs also. So could you give us some insight, like, what is the difference? What is the variation that comes in? Or how do we identify those little things, especially in children with autism?
Right. So, with children with autism, it's the part that can make working with them trickier, if we're going to say that things are trickier sometimes with kids with autism, is some of the underlying behavioral things that we see surrounding everything for many of them. And having to learn to adapt our teaching to various levels of autism. And, I don't want to lump all kids with autism together in one group either, because there's so many variations of what we see on the spectrum. But, I think in working with therapists and families, around the world for the past 20 years, the biggest challenge I see people facing is how to be able to figure out where to start and how to develop rapport with kids with autism who maybe don't have that social connection with the therapist, who don't know how to follow instructions. When we start with kids with autism who haven't had any therapy just yet and haven't been taught some of those things, that's where people really struggle. They want to treat the problem like they do a typical child with a feeding issue, or even a child who just has a motor issue, but there are so many other underlying things that can make that challenging, not for all of them, but for the ones that we're probably talking about when we're having conferences like this, those challenging clients. We try and start here at feeding when we need to be doing some underlying things. I've done some training in applied behavioral analysis, which I thought I would never do as a professional when I first started, because I'd heard so many horrible things about it. But the more I've learned about the connection between behavior and function, and how we as the therapist need to change our behavior or what we're doing to try and get our client to reach those same goals, that seems to be the most challenging part. The issues themselves around feeding are not necessarily different than anybody else, but the challenges that we see with the sensory system and interaction, that seems to probably make it more difficult for some of our therapists even to be able to look past the problem and look at some of the underlying issues first, I guess is the best way to say it.
Yeah, that's very true. I think, just moving, those foundations, like you were saying, where we work on in terms of their sensory, in terms of integrating all of that, we just jump right in to the top. So what do you think, like you were saying, like sensory integration is something that children need before we can go into, what other things would you say are very important that, professionals need to know before jumping right into feeding? So what are the
So there's a class that I teach with a behavioral therapist with TalkTools that kind of talks about this scaffolding system. When we want to work on feeding and we want to work on speech, that's my goal because I'm a speech pathologist. Knowing some of these underlying steps are really important. And the first one that we teach about that Riska, who's the behavioral therapist I teach with, really talks about is cooperation with the client, pairing with the client, being able to just have fun with them and they want to be around you. And then having some type of control over their environment and what in the ABA world they call manding, or being able to request. Those things as a foundation will help me as a therapist get to feeding. If I don't have that cooperation, if I don't have reinforcement, we all as people, we work for something. None of us do anything for free, really. And even when you're doing it for free, you're doing it because you're doing it out of the goodness of your heart. Kids with autism don't always have that internal social feeling of, I want to do this to make you happy. I want to do this to make me happy. So we have to kind of figure out, what will you do it for? If that's not established first, then all of these things that I'm trying to do, changing your motor system, changing your feeding, changing this, changing that, I'm not going to be able to do it. And so that's where I really feel like we as professionals, speech and language pathologists, feeding specialists, even OTs and PTs, really, we're not really trained down to that level to start there. And so sometimes I just have to adapt my goals and say, yeah, feeding's here, but we've got to do A, B, and C first. And all of that brings in the sensory system, because kids are disorganized in their sensory system because the environment isn't affecting them the right way. And that's a horrible way to say it. I'm sure you're going to have somebody else who can explain sensory better than me, but we do need to know about their whole sensory system, because if they're disorganized out here, they're going to be really disorganized in here, because we know sensory kind of goes from the outside in. That part I do know. And so a lot of times I have to, as the professional, say, I know what I need to work on, but you need to work with this person a little more first. And you need to work with this person a little more first. And when we have a little more of X, Y, and Z, then come see me and let's work on that next step. We don't have to know it all, but we do need to know and feel comfortable with referring. And so now I have a behavioral therapist that's in my office that I am able to have work with those clients. And then they help me as the therapist figure out what makes things work for this kid, because they spend the time figuring that piece out. So I don't know if that kind of helps with the whole scaffolding thing, but really important to have basic understanding of those things. I'm not a sensory expert, but I know enough to say, this looks a little different to me. I need you to go see a professional who can give us more information.
Yeah, definitely makes a lot of sense. So, coming into that, now when we've got children who've got, let's say they've got very specific food sensitivities, where do we begin? They're very picky about that, or they can't just, take it in. So how do we start? Yeah.
So the first thing I do with kids who have food, picky eaters, strict food preferences, is I have parents take a 5-day baseline diet. Write down everything your child eats, how much, down to the brand, if it's brand specific things that they have control of, what time of day did they eat it, what happened when you gave them something that they didn't like, so that food sensitivities, again, could be for a million different reasons. And if I can look at it over the course of multiple days, sometimes I can see trends in things. Okay, everything is brown that they eat. All right. That might be a visual issue. Has nothing to do with what's going on in their mouth, but visually, nothing is coming near me that's not brown. That's sensory. That's visual sensory. So we got to think about, how are we going to work on that? They'll only eat things that are smooth. That might be a textural issue. That might be an oral motor issue. They'll only eat at a certain time of the day. That might be more behavioral kinds of things. They'll only eat at this table with that fork. That might be, so, really looking at those kinds of things can help me start to weave in, as I've already looked at their motor system, and I've looked at their sensory system, and now I see these food preferences. Now some light bulbs might start to go off. They'll only eat fruit, so we just have to, we have to look at things from a big picture, rather than just, they're only eating 3 things. We got to know more about why those 3 things, what are those 3 things, And, one thing I haven't even mentioned that I should have mentioned a long time ago are, we are seeing more structural issues around picky eating than we used to, with the identification of tongue ties and lip ties, that we didn't identify and know as much about, 10 years ago. I had one client, I'll give you a little case study, case history kind of thing, came to see me from another state for an intensive feeding week. And the first thing I did was an oral sensory evaluation. He was pretty good. And then we looked at the foods he's eating. He's not eating much. And then I did a motor and a structural evaluation, and he was tongue-tied. And so he was eating all of these soft foods and mashing them in his mouth, but he wouldn't transfer to anything harder. But he can't move his tongue, and he can't move his tongue because his tongue is tied. So that whole week that we were hoping to spend on, let's see if we can get some better oral motor skills. Let's see if we can teach you to chew. Let's see if we can increase these foods. We couldn't do any of it because he had a structural issue that was causing part of his problem. So I want to make sure I mention that, because some of these food sensitivities or picky eating we've seen are around tongue ties and lip ties and not being able to move my mouth. And then so we work on correcting those ties. And then we still have to do therapy. Doesn't fix everything, but don't want to forget about those structural things.
Yes, definitely. That's a very important point, I think, that you brought about, and I think we should look into. So coming into the therapy part of it, okay, Now this is now feeding and speech. Now, a lot of our children, especially on the spectrum, are so aversive to it. And, they've got such negative experiences around that. And how do we as therapists, or how do parents know how to connect it, make it more interactive or creative, think out of the box?
The therapy part?
Yeah, therapy part of it. How do we? Yeah.
So we have to tell ourselves it's okay to back off of our goals and just learn how to have fun with that child.
Okay. Yeah.
We've got to have fun. They have to be able to be with us. So we can't bring out our therapy tools if they're aversive to it. We've got to work on that foundation. We've got to build cooperation. And cooperation is built around fun, and fun for every child is different. But a lot of what we don't teach them is we get the fun when we do the work. So we have to make that connection of, will they come see, are they okay coming into my space? Will they let me be around them with fun things? And then slowly, this is where we kind of mess up here too. We slowly introduce small little things to teach them that when you do this really easy thing, which I might for me and a client be, do this with your hands, and then I give you that toy that you love, they start to make that connection with, I do something, I get something. And so, I know some people are aversive to a reward kind of therapy, but that's how play therapy is. Even if we're not doing it that structured, there has to be reward for everything. And so we just have to figure out what those reward things are and work really slowly and be consistent. If we're not consistent, if sometimes they can have it freely, and then sometimes we say, no, you can't. And then sometimes we do this and sometimes we do that. Kids on the spectrum can't process all of that. And so they can't trust what we're doing. And when your sensory system is disorganized and you have these skills that you can't communicate your feelings, we've got to work on that consistency. And I found over the years that if I can start there, I don't normally have problems moving into my goals. And then we have to be okay with, I'm moving into my goals, and now this is too much for that client. Let's go back and let's be positive. So we can't rush it, which is really hard for me because I'm a doer. Let's fix it. Let's do it. I know this is going to help you, and just move on. And some days I'm I am in more of a rush just because that's where my brain is. And then other days I'm more thoughtful about those things. And I can tell that on those days where I'm really thoughtful about my clients' needs, but maintaining structure, I get a lot further faster. So I really feel very strongly that the principles that we can learn from behavioral therapy, ABA in general, really truly do help us with our clients and figuring out how to make it fun. And we have to remember that my fun might not be their fun. And so when we're sitting in therapy, I do a lot of my therapy in a therapy chair where they can't have access to things freely and move around too freely. That's my preference, and I tend to work well there. But I'm always constantly watching, what are they interested in? So if they're interested in something over there, that's what I go to. And then I just try and get them to do something to get it. And then they may lose interest in that real fast. And I can't make this my goal. I've got to put that away and I've got to go get that other thing. And so it's constantly keeping their fun in the focus and then interjecting my goals very slowly. And that's not easy. And sometimes it's hard to teach parents, but if we can't model it, we can't expect our parents to do it at home either. And so, I have all my parents in my therapy sessions with me watching. If they can't sit in the session, I have them watching over a camera, because if they can't see what's happening, they're not going to know how to do it. And just saying, okay, you need to chew on this and you need to give them this food and you need to do this. They need to see how I did that, because a lot of times there's 4 steps to get to put that new food in the back of your mouth. And if they don't know what those steps are and how to work through them, it's really hard to do. So.
Yeah, it's very true, very true. How that, I think the parent connect and, explaining it to the parents also that you all need to slow it down, because everybody's running like, no, our kid needs to hit this goal.
Right.
But it's very difficult, but I think that's something very important to understand.
Yeah. And the more the therapist knows, I think some of us sometimes we know the goal, but we're not really sure of the steps ourselves.
Yeah.
And so it's hard for us to help them slow down, because we say slow down, but if we can say slow down, we need this, and then this, and then this, and give parents a scaffold of this, we know what we want. And I promise I have steps to get there. The more we can share that with parents, and sometimes we don't even think about sharing that. If you're not a teacher, in general, we think all of this and we just kind of assume because you watched it, you must understand what I just did. It's constantly teaching them and saying, okay, I know you want them to chew meat, but we need up and down jaw movement. We need tongue lateralization. We need the sensory system to be tolerant of it. So we're going to do this step and then this step and this step, and then we're going to put meat in his mouth. Then maybe parents might be able to step back a little bit because they can see, okay, there's a path and there's steps that need to happen. And that makes parents feel more confident that we know what we're doing as a therapist, but also that they know what their expectations are. Sometimes it's just not knowing expectations.
Very true. Coming into another topic that is your field of expertise, that is completely about apraxia, that's
my favorite.
We've loved learning from you about that. So could you, we've talked all about feeding. Let's come into a little bit more about speech and in details of that. Could you explain to all of us and, especially our viewers, how complex speech is? I don't think people really understand. People just think that it's just, we talk and words are out of our mouth, but how complex that entire process is and how much of motor planning is required just for us to talk.
Okay. Yeah. Well, and I don't think we realize how complex speech is because most of our kids and people just do it without really having to think about it, but it is complex. Speech if we think about speech from the motor system, and that's kind of where I come from, speech requires movement. Those movements are multiple movements at the same time. So let's just say to be able to say, ah, very easy sound. I need to have air. I need to be able to control air. I need to be able to make my vocal folds move. I need to be able to direct the air orally, and I need to be able to open my mouth. So speech is just to say, there's 5 systems that are all working at the same time in a split second. When we talk about motor planning for speech movement, now we're talking about those 5 movements just for and let's put a with it. So even just being able to say mama, which we think should be a really easy word, the M sound, air, vocal folds, velum moves. That's something in the back of your mouth that opens and closes. Air goes through your nose for and then for your jaw has to move. Your vocal folds still have to keep going. Your air has to still go. Your velum has to drop. Air has to change direction. And then to be able to do that a second time, I have to do all that again. So when we start breaking down speech by movement, it looks a little trickier than it is, than we kind of think about it. And so when we talk about kids who are not learning speech through normal ways, and kids learn speech through imitation. They look, they listen, they play with movement as babies. Movement starts to get voice. They start to hear these sounds. Their mouth starts to move in different ways, and they hear more sounds. Parents react to those sounds, and we get that whole back and forth going, and it just happens. Kids with autism, especially kids who also have motor planning issues, that breakdown can be back to the very beginning, where I don't even have awareness of hearing the sounds and feeling the movement because my sensory system is so disorganized. I can't even get to that point. So, a lot of our clients that we work with who have motor planning issues or dyspraxia, which can be 2 different things, by the way, they're all, one or more of those complex systems are impaired, whether it's because my brain isn't telling my mouth what to do. So when we talk about dyspraxia, I'll just kind of generalize here for you a little bit. When we talk about dyspraxia, that's where I know the word I want to say. I have coffee here and I want to say coffee. I know it's coffee, but when I say it, pada, it comes out different. And if my my intellect is high enough, I'm going to hear that word and say, oh, that wasn't right. And I might try it again. Kids with autism don't necessarily yet have that processing to hear what they're saying and say, oh, that didn't match. Let me try and fix it. They don't correct. And so a lot of those kids will have very limited sounds and syllables that they'll say because their brain isn't telling their mouth what to do, and their cognitive skills aren't there yet to be able to process all of that. And so, when we see kids who are really experiencing motor planning issues because of planning, my brain telling my mouth what to do, we have to break things down really small for them and teach them, this is how you turn your voice on. Sometimes we just have to teach them how to get air going. And so from the way I teach speech, I do it in what we call a systems method, where we start with the lowest system, air. We need air. Then we work on voice. Then we work on movement, where as speech and language pathologists, we're taught to model, try again, motivate, and not really look at those complexities to really see where that breakdown is. So one of the things I always ask parents is, does your child know how to blow? Can they and do that on command? And many times these kids who have autism and also speech production delays or limited sounds, or maybe not imitation, they don't know how to blow either. And so starting down at a very low level and teaching them how to get the air going teaches them how to learn, teaches them how to copy, and then teaches them how to focus on what we're wanting to focus on. So
beautiful. Yeah,
it's complex.
Yeah, there's a lot of information, but it makes a lot of sense, truly. let's, kind of connecting that. Do all our children who have dyspraxia or apraxia, do we say that, do they end up having a feeding difficulty as well? Or, I mean,
Not because of dyspraxia. So dyspraxia is different than a feeding issue. Okay, feeding is motor and maybe sensory. Dyspraxia is my brain isn't telling my mouth what to do. But I will tell you, in the 20 years I've been working with kids with autism, that many of the ones that I see, now I see severe, I see kids who aren't making many sounds most of the time or can't use sounds functionally. Most of the time, these kids many times have both. So we might see a feeding issue as one diagnosis, an oral motor issue and muscle weakness, and we see motor planning issues. So that's what we call a dual diagnosis, that they have two things happening, not just one.
Very true. Yeah. And how would you tell, like you were telling, like breaking it down, coming into really smaller steps. And I think professionals and parents miss out on that so much,
Right.
So what would you tell them, to understand that better, to always keep in mind when working with children who've got autism or who've got dyspraxia, what are the things that they need to keep in mind when they go into doing therapy for them?
You have to do a good structural and muscle-based assessment and look at the motor system outside of function. So function for me is, do you eat well? Do you speak well? Because that's my area. And then I need to back up and say, do you have the underlying muscle skills? Is your jaw, your lips, your cheek, your tongue, your velum, your abdomen, are they strong enough to be able to move appropriately? Not that it takes a whole lot of strength, but do they have that capability? And then look at that and how it's affecting their feeding and how it's affecting speech. So there's analysis happening. So anytime you see, they don't know how to blow, they don't drink from a straw well, they don't have good jaw stability, they don't move their tongue well, that's telling me that there's a motor component of some kind that's going to affect feeding and potentially speech as well. So it's in that specific evaluation. So I don't just do a speech eval and say, copy me, and see what happens. I go a step back. Well, copy me moving your mouth. Let me see what your muscles can do. And TalkTools was developed because a lot of our kids with autism can't follow those instructions. They're not watching us. And so that's where the tools that we developed came in. The tools help them feel what we want them to do. And then we can evaluate and eventually treat those issues as well. So in my evaluation, if even a parent says, I'm here for speech, you're going to get an oral motor evaluation. You're going to get a feeding evaluation. You're going to get a motor planning in different ways evaluation. And then you're going to get a speech evaluation, which I probably won't even do until the end, because I need all that other information to help me figure out why are you having that speech issue.
Very true, very true. So Renee, I know, just one last, in a few words, I think just a word of,
I never have a few words.
Just a few, just to kind of encourage our parents, because we've got a lot of parents who get so caught up in the doing of things, let's keep doing, that they don't just really connect to their child, or they always see them for things that they don't do. Can you give a word of advice for that?
Yes. So my advice is, be aware of the things they can't do, work on those things little by little, but really celebrate the things that they can and enjoy being together, because enjoying being together and enjoying all of those things that they like and you can like together will make all of these things that they need to do easier to do in the future. And I think that's what happens is we everything becomes therapy. We've got to fix. And, we're working with children who this isn't what they're supposed to be doing as a 3-year-old and a 4-year-old and a 5-year-old. They're supposed to be playing and having fun, and parents are supposed to be having fun with their children. Use your professionals as much as you can. Do you have other people that can help you with the therapy so that you can just be the mom or you can just be the dad? And then take things slowly. Even if you have a therapist who gives you 12 things to do, because sometimes we do that, do just a little bit, be honest with your therapists and say, this is too much. What's the most important, and how, and really work as a team, but don't miss out on the fun. And looking for those little things that are happening. And I think it's important for us as therapists to point out those little things. He's clapping his hands when I tell him to now. That's going to help me teach him speech later. And this is how, if I can make them see those little tiny things as big jumps in development or a big new skill, parents can celebrate just like we are, because we're celebrating all those little things as we go, and we're excited. And a parent, they just want them to talk, or they just want them to eat. But if they can see that these little steps are going to get there, I'm thinking about one of my little clients who's going to come this afternoon. We had to work on that with their parents and really show them, look, he's moving his tongue now. Look, he's able to round his lips now. We're going to get ooh soon. Look, he's turning his voice on when I want him to. And that helped them celebrate and then be happy and then ask their child to do more of those little things. And then their child's successful. And so then everybody's happy. And we need therapy to be happy. It should not be an unhappy time.
Definitely. I think that positivity just changes a whole lot of it.
It does.
Yes, totally, it does.
It does.
So thank you so much, Renee. This brings us to the end of this wonderful discussion. I know we've just scratched the surface. We've not gone into anything, but I'm sure that there's a lot of information that our viewers definitely need to understand. And I, as a professional, learned so much in just this 1 hour. So we just want to thank you on behalf of our team. We just want to thank you so much for taking your time out of your really busy schedule and doing this for us. And we really hope it is going to be beneficial for everyone who watches this. So to all our viewers, we just want to say thank you. And we really hope that you are all able to understand the connection between feeding and speech development, and how important it is to integrate all of these movements and how complex speech is at the end of it. So we really hope you all can understand this. And if you want more information, please feel free to reach out back to us. Thank you so much.